Good morning, everyone. My name's Bethan Smith. I'm part of the Good Practice team at Audit Wales, and I'm joined by Professor Luci Attala from University of Wales, Trinity St David, and Adrian Price from Hywel Dda University Health Board. So today's session, we're going to be sharing Hywel Dda's experiences really of this work, and obviously we have Luci here to kind of talk through the study and what she found from that. So I'm going to hand over to Adrian shortly just to give a bit of background and kind of set the scene really. But first of all, just to run through a couple of housekeeping points. So you'll probably see on your screen at the moment some blank screens, but we've got Sam, Sean and Alex, who are also part of the Good Practice team. They're sort of working in the background here just to make sure everything runs smoothly today, and we'll be looking at your questions as they come in. Speaking of questions, you can email your questions to us. So via our email address, which is good.practice@audit.wales. We've obviously got the Q&A function on Zoom here, which is probably the easiest way to get your questions in. We've also got the chat function as well, if you prefer. We've also got our Twitter page as well. We've got a hashtag for this morning's session, which is hashtag #AWFutureWork. So if you're used to using Twitter and you want to send us a question over that route, feel free to. We'll be picking those up as well. Just to say, there is an option as well to keep questions anonymous if you prefer that. We won't obviously mention any names unless you want us to, and we can bring you in and unmute you if you'd rather have a bit of a conversation this morning. We're trying to keep it quite informal. Obviously, it's a lunch and learn session, so we want it to be more of a conversation rather than a presentation to you. So yeah, just to mention, the webinar will be recorded today. What we have to do after the event is just get that transcribed and translated. So it'll be available probably in the next sort of week or two, and you'll receive a link to that shortly. So yeah, that's all from me really at the moment. I'll hand over to Adrian now, who's going to, as I say, talk through a bit of the background really and kind of your experiences from the health board. So Adrian, I'll hand over to you.
Thanks, Bethan. Afternoon, everybody. So yeah, I'll just give a very short kind of summary of how we got to this point, and then hand over to Luci. So in the county of Ceredigion in Hywel Dda University, we got to the stage where two of our hospital sites, our community hospital sites, were closed down and decommissioned, and brand new buildings. Sorry, I just had a charger delivered in case. Thanks. And brand new one brand new building was built from the ground up, and another repurposed and completely refurbished. A lot of work went into that whole project over many years. And the focus was largely around the buildings, the material, the architecture, the nuts and bolts and bits and bobs of the buildings, and not necessarily the human aspect and the team aspect. So I think what was, and I say I think because I wasn't there, but I think what was a chance meeting between Sue and Luci then in another event, they got chatting about this, and which led to Luci becoming involved, and we managed to get agreement and funding for a project that did look at that human element, how the change was managed, and how the transition from our known old buildings, which were known, in some cases very much loved as part of the landscape and part of the community, how the change was managed then from those to these new environments, really. And from there on in, Luci got involved, and the rest is history, as they say. So the important bit, the fancy bit, I'll leave to Luci.
Thanks, Adrian. Luci, should I hand over to you?
Is that my introduction, Adrian? Thank you.
That's as good as you're going to get from me, I'm afraid.
That's lovely. So, as Adrian's explained, there was this quite significant move, and to Sue's credit and to this chance meeting, I was asked to come in and think about the shift in culture that was, anticipated in the rehousing of individuals from sort of very disparate, maybe dilapidated offices in some cases, different departments into a shared building. So that was quite a shift in work culture. And along with that, rather than just all being housed in the same buildings in their own departments, staff were then also asked to not work in the same area every day, but were asked to use open plan offices and using bookable workbenches each day as they came in. Now, this is only to do admin work for the NHS. The clinical areas, of course, have departments. And so where service users come in, it's, still organised in terms of departments, but upstairs where people do their admin work, where they do their notes, where they file things and so on. That was, and where people have meetings, that was achieved in these new shared areas. So Sue was absolutely right to be concerned about how people were going to manage this change, and that there was a possibility of it being problematic to negotiate, because not only is moving difficult, but that quite significant change in culture was already starting to cause some tension within the workforce when people in their teams were discussing what the move would be like, and were being able to contribute to the design of the building in terms of, what the soft furnishings might look like and so on. So there was this sort of sense of tension already generating, and hence then Sue wanted an anthropological study. Well, not only Sue was the first person who suggested it, but above that, other managers also agreed, and to their credit, absolutely agreed that it would be a good idea to find out how this move was being experienced. So not how to organize people to make it a successful experience, but rather actually look at what people were experiencing. So they wanted some raw information about how people felt about the work environment. And they didn't really, as far as I was concerned, that was why, as an anthropologist, I was called in. This was not to make a fanfare about the buildings. That did happen and should have happened, but was not my job. My job was to look at people's experiences. And from those experiences, then I extrapolated a series of different themes under which the experiences could be organised. And I haven't got time to go into all of those themes in any detail, but a report was written and has not yet been published, but will be published in the future. So people can read that if they want to. So, really then, what I was told by management was that there was a design philosophy that was being sort of outpictured in the building, and the design of the building was supposed to reflect in practice the ideas held under the heading of integration. So we all know that the word integration in terms of organisation means effective or enhanced communication. And so I was told by management that the reason why people were being discouraged to congregate in their teams, as had always previously been the way, and were being encouraged to use these work desks, was because they wanted people to randomly collide with, quotes, work strangers, so that would foster an atmosphere of sort of collaboration, where chance encounters with individuals that they'd never met before would possibly spur innovation in thinking. So people would get to know each other, and then they would share who they were, and then they would talk about, what they were doing in their work and find ways to collaborate. And that was that was the basic philosophy of the building. And I think quite a lot of open plan spaces and these bookable work desks are sold under the notion that collaboration will be encouraged, and that there is an understanding that collaboration is sort of by definition a good thing, that it not only is it good for the workspace, but it's it provides the potential for innovation, which would otherwise be avoided. So there was a sort of shuffling of staff that was expected. That's one key point here. And then there was this sort of proximity to others that was promoted. And that would occur because literally the barriers of the walls were taken away. So where people had worked in offices before, they now had to work in what kind of amounted to, you know, just long workbenches of desks with tech placed regularly on them. So it was very streamlined, it looked very efficient, it wasn't cluttered in any way. People were told that they were not allowed to personalize any space, not frequent a space often, they had to keep moving around. And so this was the new practice that people had to move into. So I'm sure you can anticipate immediately, just hearing that a number of people would find that quite a challenge, that people who might not be that confident about engaging with others would find that quite difficult. Finding a new space every day is a challenge for all of us, I think. And so I too noticed that this was an issue, and quite a few people were immediately worried about the fact that their teams would be broken up, that how they had been used to working with the people that they were used to being around every day, and the particular team cultures that they were used to were now going to be scattered and dissipated around the building, and that they wouldn't be able to find each other, and that they would spend ages trying to locate where someone was, and that something about their, you know, the practice that they were used to had gone. And so removing the walls, rather than creating possibility for a significant majority of the people who were moving in, quite confident people as well, who were, you know, in leading positions, were troubled. Anxiety was produced. You know, these walls had come down. There was a sort of sense of possibility and openness advertised by the space. But the reality of moving into it, finding a desk, sitting at a desk, finding your colleagues every day was doing something different. And so regardless of these clean lines and all this new tech, you know, this was often that people voiced their experience of the space as impersonal, homogenizing in the sense that everybody's the same, and strangely rigid. So they felt as if there were a lot of rules associated with using the space that they weren't used to. And with that, then the buildings were described to me either as libraries. So quite a lot of younger members of staff who'd come out of studying said, "Oh, this is like the library. You know, we're just in the library." It didn't feel like it was their office, a place for them to belong in, but a place for them to come and maybe get a bit of information and then go out again. Equally, people said that they felt like they were in an airport, and this was exacerbated by the fact that they didn't have a place to put their items and were given sort of regulation wheelie bags to drag their files and necessary equipment around. So they felt they were in the transit lounge, you know, perhaps not going on holiday, but on some journey somewhere. Or also a train station. So there was this sense of being in transit, and there was a sense then of not belonging, which was one of the themes that came up as an issue for many people in different ways. So, you know, where one passes through temporarily is the place where one doesn't belong, and typically in one's work. Most of the people in this situation were used to belonging to a space. So, you know, this shuffling of people, this obligation to look for a different desk and to sit next to a different person every day, or as much as was possible, and that was slightly policed as well at the beginning, which I found quite interesting, actually discouraged teams from congregating in the way that had been the norm, and that caused a problem for the teams, But that also caused a problem for the people who were used to working in private, so perhaps managerial individuals. Those people who had actually designed the building as well and signed off on it were people who were suddenly realizing they had to sit next to other people to do staff appraisal paperwork or whatever, and so they didn't have the privacy that they were used to. So immediately then you can start to see, right, this is causing problems for those people at all levels. At all levels, there was an issue with the fact that they had to work alongside each other and that there wasn't any privacy at all. And that was causing apprehension for a lot of people, and any anxiety or apprehension affects one's well-being. And so that was impacting on a lot of people in different ways. There's quite a lot of really high emotions were raised, and people choosing to work in their cars as an act of defiance, I think. And so there was this stress. Now, let's acknowledge that any change creates stress, any change at all, and humans are really bad at dealing with stress as it happens. And so, we have to kind of take that with us as we go along. But nevertheless, this notion of being in transit was described, weirdly enough, chiming with other writings that I've come across about hot desks particularly, and these kind of workbenches, open plan workbenches, created a sense of people feeling homeless, and they actually articulated it as such. So they said, we don't have anywhere to belong, we don't have a home. They actually got quite angry with those people who have offices in other buildings because they said it's all right for them, which was creating this kind of two-tiered society where you have the homed, those people who have offices in other buildings, and those people who don't have any offices at all and are always expected to work in these shared spaces, dragging their little trolley behind them, not even with a cupboard sometimes to put their stuff in, although that was negotiated later. So immediately then, to the credit of the staff and the ingenuity of being human, everybody started concocting different reasons and methods to kind of circumvent these rules, and they found all sorts of alternative means to kind of adapt the building to almost to revert to their former way of practice or their preferred way of performing work. There was a lot of creativity here. People were sort of sneaking around and making changes to things, and I found that incredibly interesting. Something that I didn't say earlier was that part of this study took place over 2 different periods of time. So I spent time, sitting and being in the buildings and watching people and talking to them as people moved into the buildings in the first instance. But I also came back later, 3 months after, to see how they'd settled in. And in the first chunk of time, so that was about a month or 5 weeks at the first chunk, I was noticing how people were getting quite, angry and agitated about things, but finding ways to reform teams sort of informally in certain ways. And then by the second time when I came back, people had informally formed their teams and regrouped despite the rules. So it was interesting to see that they had found a way to negotiate this change. So, what does this say then? Yes, we can see that people struggle with change, and yes, there's a kind of ingenuity and human creativity in dealing with change alongside the stress. But what else does it tell us? Well, I think it tells us something about work cultures generally, and about these open plan spaces, or the value of hot desking. See, hot desking is often advertised as these collaborative places where perhaps innovation can occur. But if we're really honest, I think we'd all agree that this is an economy drive. This is much more about getting away from having to keep separate spaces going, and there is a sense of kind of economy in getting everybody into one space and then getting everybody out of that space at the same time. There's a almost like a McDonaldization of the world, which is an interesting book if you haven't read it, thinking about how McDonald's has influenced work cultures everywhere by creating these kind of shared spaces that are used by McDonald's. Sorry, tangent, went off on a tangent. I do this, you have to rein me in. Okay, so what do I think this says about work cultures? Well, I think that these open plan spaces are advertising a kind of equality that doesn't exist in work, and so they're not going to provide the innovation and collaboration that is expected of them, or that is hoped for by them. So I think what they will do is they'll make people come and go and use the spaces in a slightly different way, but I don't think it's going to encourage collaboration. And that's partly because people want to come into the space and get out of it as quickly as possible. It's partly because they want to work with their teams and they don't want to meet strangers. They find that difficult. And it's partly because the hierarchy that exists in all organizations continues to function within this open space. And that's very difficult for people to deal with, difficult for people at the top as much as it is for people at the bottom, because people at the top don't know how to share their space in the same way. They haven't got the sense of kudos. They haven't got the corner office. They don't really want to be hanging around with everybody. And people at the bottom are feeling uncomfortable about maybe sitting next to people higher up than them, and worried about how they can discuss things with people who, you know, might be managers sitting next to them. So that kind of problematizes the space for them in many ways. While these spaces are fantastic in the sense that they are new and they are clean and they're fresh and bright and they've got good IT technology available to the staff, what my report suggests is if the individuals who design these buildings want staff to collaborate, then they need to provide spaces in which collaboration occurs, not places where people do their desk work in rows like a library. So that factored into work time are collaboration times. So not meetings organized, but almost like shared common rooms, even like we used to have in the old days, where people would sort of hang out together. And at the moment, the kitchens in the buildings function a little bit as the place where people can chat, but people don't want to chat about work in their lunch break. And they say quite clearly, oh my goodness, they've got another thing coming. If they think I'm going to sit in here and carry on talking about work in my time when I'm not paid, they can forget it. So they quite clearly said that that was not going to happen, which then suggests that if people actually do want staff to collaborate and informally chat together to come up with new mechanisms, new pathways and so on, then they really need to factor that into work time and pay people to do that, which at the moment does happen for people at certain levels where they go off on, you know, lunches, where that's exactly what that is, a work lunch, where you're networking and collaborating. But that's not the case for people at different levels. They're not expected to do that in their work time. And in fact, if people do chat in those workspaces, people are told to shh, because this is work time. So you've got a hell of a lot of different kind of impacting tensions there, which I've covered in brief, perhaps for too long. I don't know, because I can see there are 4 questions. Perhaps we should go for the questions. What do you reckon, Bethan?
Yeah, we've had a couple of questions coming in. So one here that says, were the new offices being occupied by 100% of colleagues, or was there a mixed working environment with some working at home?
Yeah, so that's a great question. So the notionally associated with this change was the sort of directive that work would now be much more flexible and agile. So sort of, you know, hand in hand with collaboration and innovation in shared spaces comes the notion of agility and flexibility. And often, the wheelie bags and so on were defined as the things that allowed people to be more agile and flexible. So some people did take the opportunity to work away. And also, I think you need to remember that in the NHS, a lot of people are coming and going from different spaces, sort of by definition, you know, out to the district, you know, midwifery to schools to so on. So they're often, you know, sort of coming and going to things and do quite a lot of work in their cars anyway, sort of historically. So there was a mixed bag, but equally within that, there were a lot of people who said, I don't want to take my work home. I don't like the idea of having to look after a laptop after hours. I don't want patients' records in my car. I want my car not to be full of, you know, the whatever machine they need to take for their clinic, their mobile clinic somewhere. I don't want to have to keep that there. I'm used to bringing them home and bringing them back to work, and storing them at home, not at home, at work. And so therefore I don't want to store them at home. And actually now my husband is getting really angry that the car is always full of either private and personal documents or all this equipment. So that's a sort of answer to your question. Ostensibly, theoretically, and in the abstract, the notion of flexibility and agility sounds fabulous. It sounds like you're giving people all of this freedom, but it's not actually experienced like that, because the work cultures, the traditional work cultures that are already established, continue to affect the way people can understand them. And you can see that already with COVID, right? So we've all been told, you know, sit at home and do your work, and we've all been doing it, you know, like good people. Now, everybody's saying, we must go back, we must. And I'm thinking, must we? Why must we? Why? But everybody's desperate to. For some reason, everybody thinks it's really important that work is achieved in the workplace, in that space. So people really struggle with these changes because it impacts on the way that they understand what work is. And people seem to resort back. So there's quite a lot of work to do to shift people on into sort of understanding that work is perhaps not achieved in a place in quite the same way that most people imagine it is. Did I answer that? I don't know. Maybe.
Yeah, no, definitely. I think so. I think, Adrian, did you want to come in on that one?
No, I was just going to say that the question was about working from home and office space. So at the very start, every member of staff, and again, it was a very large piece of work, as Lucy said, kitted out with new laptops, mobile phones, bags, lots of equipment, tech, up-to-date tech, in order to be agile and offer that freedom. And as Lucy said, because the human factor wasn't necessarily considered right at the start, just the dishing out of equipment wasn't quite enough for people to understand how to now go forth and use this in an agile way. So they were still attending their base, so the new builds, on a daily basis, most people, and using all that kit from there. Now and again, as Lucy says, taking it out on a visit, because this is largely a community workforce we're talking about. What I was going to say then is COVID actually has been a help in that regard. As the, you know, in all walks of life, people have had to learn and adapt extremely quickly. And what it's meant, in my opinion, from looking at the workforces now of these buildings, they've suddenly learned what maybe was intended initially. They've learned what being agile can mean, or being flexible in their work patterns and movements, and maybe using the equipment more effectively now, whereas it was just a bunch of stuff that they took to the new base previously. And I think COVID and everything that's happened since has actually facilitated and helped teams learn quickly, and therefore use the buildings in a different way. Better, don't know, maybe, but different again from even when we did all of this work early on, Lucy, when you did the work early on. So yeah, that's all I was going to say is when Lucy mentioned COVID, it in a weird way, it actually has enabled teams to use the buildings more effectively.
Yeah, it's kind of, it's I think it's given, like you say, it's given everyone that kind of boost, hasn't it? It was almost like overnight, the way we worked was kind of completely changed. So yeah, sorry, Lucy, did you want to come back in on that?
No, not at all. Carry on.
That was the only other thing I was going to mention as well, was I think we spoke a lot about the open space areas. Slightly different in the two buildings. One of them is larger, one of them slightly smaller. The ratio of clinical space, which is mainly the downstairs areas, and then the office admin space, the ratio is slightly different in the two buildings. There are rooms then that are bookable, so breakout rooms or meeting rooms, or people call them different things. So the ability to be within four walls then with a door that closes is there for staff. It's just a process. It's a booking process then to go through it. As we mentioned, the rules, you can't just walk into a room and sit down. It needs, and there are tablets on the walls and swipe cards, and the tech is there. These buildings are, for our neck of the woods, pristine and really high tech. Everything is just a bit more of a process and a mechanical kind of process to be able to sit down within four walls, close the door, and talk openly instead of being in the open hot desking area.
Yeah, you. It's good that you've added that, Adrian, because the tech is definitely there, and I think a lot of money, went into that, as if to suggest that tech is very important. And I think the tech is important. I mean, look at us; we're reliant on it right now, and we are in many different ways. So that's undoubtedly the case, but. And people know how to use tech, and those people who are sort of, perhaps a bit Luddite are kind of running up the rear, but they're catching up, and everybody sort of has to. But that doesn't really get away from the fact that something very fundamental about what work is has been challenged, and I think has not been accounted for in many work environments. And I think that that's where this discussion is useful for other organizations. I think there is a trend towards these open plan spaces, and I think that's because they're economically better for an organization. But there's also an extraordinary amount of literature that says that everybody who works in them is unhappy and hates them. So yes, people can get used to things, and yes, a lot of people are considered, I sort of imagine that work is going to be uncomfortable and they're going to slightly hate bits of it. We just sort of accept that. That's fine. But if these spaces are advertised as spaces in which collaboration is more likely, and that's what they were sold on, that the kind of integrated care that's necessary for the NHS to function well will be facilitated by the spaces, then I think that's misadvertising. I think what will happen is that people, when files go onto the computers and when people understand the tech better, there will be some enhanced communication in terms of the services. But what there won't be is the collaboration and innovation in the way that it is suggested. And that is because the spaces do not encourage that. They encourage you to come in and get out. They don't encourage you to hang around. They don't encourage you to chat and make a noise and have, get to know each other socially. In fact, that is actually frowned upon by managers who are in the space, who tell people, shush, don't make too much noise, and by those individuals who are using the space, who understand how to sit in a library quietly, because that's what we understand. We're not there to go, hey, all right, you here, who are you? Gosh, never seen you before. Not encouraged to do that at work. That's not considered work. And yet that is what the buildings kind of, wait a minute, that's what I was told the buildings were hoped for, we're going to provide. And I think that's the way it's sold in the abstract. And in the abstract, it sounds beautiful and wonderful and something that we all want, a relaxed space where we're all equal, where we can communicate, where we're encouraged to collaborate and encouraged to innovate. We're giving them space and time to do that. We can spend maybe all Thursday afternoon just chatting with people and getting to know who they are, but that's not the reality of work. And we know that. You know, all of us know that, regardless of where we work, you know, that is not the reality. And so all of the people who, you know, were coming into the building were thinking, what? How am I supposed to do this? How am I supposed to work and collaborate? Well, the collaborating bit's out the window because this is a workspace. Yeah, we're not here to sit around and chat. We can sit around and chat in a meeting, but we can't sit around and chat here. So we can arrange a meeting, but that's not casual shuffling, proximity, work stranger collaboration. That's not that. So there's a disconnect between the abstract theory and the reality of the actual phenomenological lived experience of those individuals using that building. And I would venture to say that that is true for pretty much everywhere except for maybe Google offices or some, you know, somewhere in Silicon Valley where they're all bonkers anyway, but in a good way. No, so that I think is the key kind of takeaway maybe for other organizations or people who are imagining that they can create collaboration. They need to think again about what they mean by collaboration and how they expect those workers to be able to actually use the space creatively when, one, they enforce a whole load of rules on it, and two, people don't understand that kind of thing as working, as being at work, unless they're the kind of people who are encouraged to go on networking events and you know, have lunches with, you know, the Vice Chancellor or some, you know, other important bod. So, the majority of the workforce do not do that and are not expected to, and are considered to be slacking if they're chatting. So this is the tension. Great in theory, slightly different in practice.
Yeah, I was just going to ask Lucy, I mean, it may not be a question for you, and maybe it's something I should pose to the people listening, but have you seen any examples of, or have you come across any examples of organisations that have managed to get the collaboration side of things right? Like, have you seen any?
Well, so in my experience, and it's limited. I've got to be honest, it's limited about, you know, huge organisations, but small cooperative run community groups manage to do it. They manage to enable that. Those organizations that are in the creative industries that know they have to spend time working again on an idea again and again and again, not something that's almost like a factory line pushing through kind of services, is more likely to be able to do that, or more likely to be able to understand that mindset that's necessary. Yeah, but sorry, Adrian, did you want to say?
No, that's what I was going to say. I think in order to be able to achieve what we're talking about, I think, you know, an understanding is needed of what we're talking about when we say collaboration, integration. And I think early on in this project, one of the interesting points was the variance in understanding, or what people hold as a definition of integration. Lucy was talking to all these different people, and everybody seemed to have a slightly different take on what integration meant, even though it's a word that's used over and over again, particularly in the NHS. And everyone had a slightly different take on what it actually meant. Now, if those are your building blocks, then what you're trying to achieve, nobody really is invested or understands what's the actual end goal here, if their own definitions that they hold are so different. So that right. As well, those are the two main things for me, I think, at that point there, as well as what Lucy mentioned about what's defined as work and what's defined as a waste of time, and then being nothing in between. Those two, I think, are the key ingredients in getting this right.
And I think that point about integration is really pertinent, because it is a buzzword now and it's used all the time. And people don't actually know what they mean when they use it. They're just accepting, oh, that's what we need. We need that. That's going to be good. We'll get that. How will we get it? Oh, I don't know. We'll all be in the same room. And you think, well, okay, but let's actually drill down into this and think, what are we talking about? What do we actually mean by integration? And so in the NHS, integrated care is a well articulated and communicated and thought through concept, and it works very well. But that's facing the service user. Integrating the workforce to be able to provide integrated care is a completely different kettle of fish entirely. And so when you speak to people in the NHS and you say, what does integration mean and what does integrated care mean? They conflate the two all the time, almost like as workers, they don't exist and they're not part of the process. Like it's almost like there's this machine and they're part of it, and they'll, their aim doesn't matter about what they need. Their aim must be to provide integrated care for the service user, and it's going to be person-centered, and it's going to be amazing because we're going to, whizzy-woo all the services. It's brilliant ideas. But when you say, well, okay, how does that happen in terms of you as an employee? What is it exactly you going to be doing? They go, oh, I don't know, emails, and you think, all right. I don't know either. So this is the difference between the abstract or the theoretical ideas and practice. And in theory, fab. In practice, needs a bit of work still.
Yeah, thanks, Lucy. Just looking at the questions now coming in, so we've had a few more here. So the next one: how were the benefits going to be measured, i.e., increased collaboration?
Yeah, I don't know how the benefits are going to be measured. That's up to the managers at Hywel Dda to organise that. There was a little bit of talk about maybe getting me back again, but I think actually that might not happen now. I'm not sure. I feel as if there's some reticence because they're a bit worried about what I might say, which is sort of silly, but. Adrian, maybe you know more.
I don't know more on that front, Lucy, but what I would say is, in terms of an actual measure of, I can't remember what was in the question, efficiency or collaboration.
That's it, yeah.
I'm not aware of any measurements that were laid out at the start, and I'm not aware of any objective measures in that way. What I think could be viewed as a measure of some description is the way the report has been received and actually taken note of and listened to, and the fact that another building in the county is in the early stages of development, and how this project and report will influence now our design and of that. And I think that will be a terrific measure of our organisation and our ability to adapt and learn in light of this quite novel project, really.
Yes, no, and really, I mean, so much credit to you guys that you were prepared to do this, actually. Really, genuinely think that. And in my findings and recommendations in the report, there were some really easy fix solutions to this about, encouraging people to snack and, maybe putting easy chairs around the place and making the kitchen bigger. There's some really easy solutions to design the designs of future buildings, because I know this is being rolled out across Wales. I'm just hoping, fingers crossed, that people will listen and that people will, be thrilled to come to their work environments, because they're not being sort of policed to, eat in a certain place at a certain time, and that they are enabled to be sort of bit more collaborative in the space, or a bit more informal in the space, perhaps. Yeah, but time will tell.
Yeah, that's great.
I think the report has gone out to everyone.
That's what I was going to say. Yeah. That's the other good thing, is that we're and I say we, it's not me, it's the royal we. Our organisation is not holding this close to its chest at all.
No.
This is important learning and is being shared. So that's another good point.
Yeah, I think that's why we were so keen to share your story and have you both here today, because there is so much learning in it for for other public services, particularly at a time when everyone is looking at, at workplaces. So yeah, so a big thank you for you being so kind of open and willing to share what you've come across. Just conscious of time, so I'll run through these next questions that are coming in. So, do you think the return to workplace is driven by human need to interface with others, or a fear that workers will be viewed negatively if they're not seen in the office?
Can you say the second part of the question? Viewed negatively.
So do you think it's sort of people wanting to go back to the office is driven by human need to interface with others, or a fear that they'll be viewed negatively if they're not seen in the office?
Yeah, no, that's a great question. I think it's really pertinent. And as with all things to do with humans, there's going to be a variety of different reasons for people not coming back. I think I think some people really do want to get back and be with other people, and they've missed it terribly, and they need that human interface, and they need the connection, and they need all of that closeness. The trouble is a lot of other people don't. So there's that. But I also feel as if politically there's quite a lot going on at the moment in reference to that, and so you've got employers imagining that workers aren't doing the work, even though many reports have shown that working at home actually means people do more work in their day. But there's still a feeling of people sort of getting away with something, I don't know, by not coming in. And so I think employers are encouraging people to come back for that reason, almost because they want to see them there. And so for that, people will be worried if they say, I prefer to stay at home, that they would be thought of as negatively. And also perhaps also kept out of decisions, that they might miss by not being wherever they were before, what office space they were in before. I think, to go really heavily political as well, I think there's, a worry about the spaces that used to be frequented by workers, and the government wants the finances to flood back into those areas so that businesses can run in the way that they used to. So there's a lot going on in that question. I really hope that employees and employers alike will see the benefit of people not traveling around so much for their own well-being, if they can make that choice, and for the planet as well, for the lack of rush hour and fumes and all of that sort of thing. I really hope that we don't just all go back to traveling miles every day for no reason.
Absolutely.
Just a little bit on the end of that, though. I agree with everything you said. Obviously, she knows more than me, but from experience, so from managing a team now, the way I would answer that question is, granted all the stuff Lucy just said, but the people themselves, I think, are missing a workplace and are missing a family, a work family, and I think from my side of things, from my experience, I have experienced a real hunger to get back from the teams themselves, from the individuals themselves.
Yeah. I think that's true. I think a lot of people have felt like you and are pleased to get back, but I think there's also a lot of other people who prefer to put time into their community than the office. And so they're thinking, if I'm not traveling for 3 hours a day, then I've got 3 hours to do other things with my family, or at my home, or the local somewhere or other, So I feel as
I think a mix of it is the way forward, isn't it? People want to come in and have an afternoon or even a day or whatever with their work family.
Yeah.
But with the freedom to not do all the traveling every single day just for the sake of being at a base and clocking in.
Yeah.
So there's an area in between the two.
Yeah.
That's a nice fit, I think.
Yeah, I agree. And I think probably that will be the way that, some people would be afforded the benefit of being able to choose if they want to spend, 2 days in, 2 days out, or, an afternoon out rather than every single day or something like that. I'm hoping that will be the way. I think a lot of people would be happier if they had that. I think it's very stressful, all the driving and rushing around.
Yeah. I was just going to say, it's just about having that choice, isn't it? I think for people to have the choice themselves and what works best. And yeah, I think traditionally where we've always kind of had to go to a workplace, sometimes it's nice to have that choice. So actually, if it works better for you, then much more flexible. So
exactly, yeah.
Next question then is a bit more practical. So with the colleagues who are attending the office in a far more fluid way now in this COVID time, how do you ensure you have sufficient fire marshals and buddies for personal emergency evacuation plans when you cannot guarantee who will be in the office on any given day? That's a great question.
Adrian, I think you should take that one.
Each of the buildings has a service user group, operational service user group that meets regularly, and the policies around fire safety and health and safety and infection control in particular lately are updated frequently and discussed there. So in as thorough a way as possible, rotas and cover for that type of thing are set up, as well as now what we're finding with infection control is the booking of rooms. What we've noticed more recently is a massive demand for these buildings, and particularly their clinical rooms, their workspaces. So a whole new procedure about how to, because it was an electronic booking system, basically, first come first, so you get on and try and book a room. But now there's even been a small, well, it's not informal if it's been formed, but almost a multidisciplinary panel to try and judge the clinical need and capacity demand and all of this. So all of that now is part of our kind of operational working groups that meet frequently. So fire safety and buddies and things like that is included in that and updated as needed.
Brilliant, thanks Adrian. So the next one then, coming back to sort of, we talked a little bit about collaboration earlier, but the question is, don't you need some commonality in the tasks in order to work on collaboration in practice?
Yeah, so whoever said that is really spot on, and that's exactly what was communicated regularly to me. So on the one level, people would say, well, there's no point me sitting next to somebody who doesn't understand my work. Say you're a diabetes nurse, for example, and there's no point sitting next to somebody who isn't in that kind of framework. They're not going to be able to help you, and so that sense of commonality, the need for commonality, came through regularly, and that was voiced in association with saying, I need to be with my team. So I need to be in an area where I can just shout over the desk, oi, so-and-so, where's the file on, what's it? Rather than, maybe sitting next to a consultant or, a physiotherapist who doesn't know that individual. And so that was, a really big problem for a lot of people. And that's why they all managed informally to find ways to sort of divide up the spaces into kind of teams by, after 3 months. So, all the community nurses were sort of knew they'd all be in one area. They wouldn't be in exactly the same desk, but they'd kind of be in the same area. And so on. Or, public health would, always be in that corner. And so they sort of occupied zones in the end, without a barrier, without a sign to point them in that direction, but they all sort of knew that they were doing, which meant that none of them were collaborating with people out of their team anyway. They'd found a way to sort of look like they were all mixing up, but they weren't, so human creativity is fabulous. But I also do think that by that point, a lot of the managers or the team leaders or the people who were kind of in charge of the teams also went, oh, sod it, it's fine, whatever. Yeah, and so it all sort of relaxed a bit.
I think this is the last question we've got now, which is great because we're just running out of time. Again, it's quite a practical one, so maybe are there breakout areas in the office, or is it mostly desks? If there are they used regularly?
There are breakout rooms, and there are a number of them. different sizes, and they are booked for different teams to have meetings or conference calls or something by the different people who use the building. Unfortunately, in one of the buildings, they've got very, very thin walls, so it's quite easy to hear what's happening in the meeting. That's just a sort of practical point. But they are available. But they're not. Then you're not supposed to just jump in the room and quickly use it. Like, say, I met someone on the corridor and said, "Oh, look, we just need to chat about this. Let's jump in this room." You have to book it to use it. People did just jump in them, obviously, but the rules were such that you weren't supposed to, because somebody, there was a little sign up saying, somebody might be using this. And so there are breakout rooms, meeting rooms, a selection of them scattered around. Yeah, so
really practically what the way they look, one of them on the lower floor has clinical rooms which are multifunctional, and that's another thing that was really emphasized and reinforced at the start. There isn't a nurse's room and a physio's room and a GP's room. They're all multifunctional clinical rooms that again were booked with a GP practice out the back. And then on the top floor there are multi-use rooms, so meeting rooms as people tend to call them. Some can take up to 15, 20 people, some are 2 or 3 people. They all have these high-tech screens and projectors and links for everybody's new laptop. And then out the back, and then the kitchen in between restrooms, and out the back is your large open space. The other building, slightly different proportion there. That one has much more clinical space on the first and second floor. A larger open hot desking area upstairs, and that building has fewer kind of meeting rooms, but they are available. Each of the rooms has a tablet on the door. So, and we all have cards. Well, we have cards with swipes on them. So you can swipe and book the room as you walk in. And then the thing turns red. So it's basically like an occupied sign. So you can close the door, someone knows you're in there. And you're supposed to swipe then on the way back out. When that works, it works. But when it works, it works. Otherwise, you get a bit of A4 paper and say occupied and sellotape it to the door.
And also sometimes people booked the room and didn't turn up. So a lot of the rooms
exactly that.
Because I kept going around.
A lot of them are red, but when you open the door, they're empty.
Are red and used or.
So to answer that's kind of what the buildings are. To answer the question. So, but as Lucy said, some of them, particularly the one building, has almost a breakout room within the hot desking area, and that's mainly glass on 2 sides, and then the other sides are really quite thin. So you can have a breakout in there, but not for private conversations.
Not at all. And of course, there are some really private conversations that need to be had in the NHS when you're dealing with very sensitive material, which is something that worried a lot of people. It's not something that we've covered here. The noise level of an open plan space alongside confidentiality issues. So that's specific really to the NHS, but perhaps is transferable to other office spaces. And one last point, because I can see we've got a minute, that I'd like to add is that there is a surveillance issue that comes up, that people are tracked in accordance with swiping and so on. And while that might be very useful for fire drills or whatever, and health and safety, it comes with another cost that it is being marched out across the world. And so perhaps, we're all just going to have to accept it, but perhaps is something for a different conversation one day.
Thank you, Lucy. Just one very final quick question. We've just been asked: is the study findings, is that available publicly online for people to access, or?
It might be in the repository of the university, but it's in the process of being published, so it's not quite ready, but it can be. I'll let you know, Bethan.
Brilliant, thank you. And once we've got access to that and a link to that, we'll make sure we share it with everyone that's here today. So big thank you, Lucy and Adrian, for your time today. It's been a really, really interesting session. Thank you for being so honest as well, and it's really refreshing to have these conversations. Just to remind everyone that's been listening today that The session has been recorded, so we'll share that in a couple of weeks' time with you. Obviously, for any colleagues that might find it useful, feel free to share that. But again, thank you all for your questions, and I hope it's been useful. So I'm going to sign off now. Thanks again, everyone, and see you soon.
Thanks for coming, everyone.
Yep, thank you.
Bye-bye.
Bye.